Hello everyone, hope you're all doing good. In this video, we are going to discuss about abnormal uterine bleeding. So, what is abnormal uterine bleeding? Any deviation of frequency, regularity or duration of the cycles. Okay? Duration of the cycle from the normal menstrual flow pattern. Okay, from the normal menstrual flow pattern. Okay, so that is abnormal uterine bleeding, and this is usually seen in 10 to 30% of the reproductive group age women. Also, it is seen in 50% of the perimenopausal age group women. Okay. So, let's see the normal FIGO parameters. Okay. So, that is given by the Federation of International Gynecologists and Obstetricians for normal menstrual cycle. Okay. So, what are the normal FIGO parameters? First one, let's speak what is frequency. Okay, frequency of the menses. It is given in days, and the normal frequency is usually between 24 to 38 days, and this is said to be frequent cycles when the cycles are happening less than 24 days, and these are called infrequent cycles when the cycles are happening more than 38 days. Next parameter is regularity. So, regularity of cycles. This means cycle to cycle variations over months. Okay. So, this means cycle to cycle variation over 12 months. Okay. So, cycles can be regular when there is a variation happening between plus or minus 2 to 20 days. Okay. And the cycle said to be absent, that is, the cycle didn't happen at all when there is no bleeding, and it is said to be a prolonged cycle when it exceeds more than 20 days. Okay, so this can also be called as a irregular cycle. Okay. And the next parameter is about the duration of flow. So, how many days the flow of menses is happening. Okay, so duration of flow. So, this also we are mentioning it in days. Normally, the menstrual cycle lasts between 4.5 to 8 days. If it's shortened cycle, that means it will be happening less than 4.5 days, and if it is a prolonged cycle, it will be happening for more than 8 days. Clear? And one more parameter we have, very important, is the volume of the monthly blood loss. Volume of the monthly blood loss, that is given in milliliter. Okay. So, here the normal volume usually lasts is between 20 to 80 milliliter, and if it is a heavy flow, then the volume loss will be more than 80 ml, and if it is a light flow, then the volume loss will be less than 20 ml. Clear? So, this is what you have to remember. Very important. Okay. Right. Now, we also have certain new terminologies in abnormal uterine bleeding. So, what are the new terminologies? New terminologies in abnormal uterine bleeding include, first one is heavy menstrual bleeding. Okay. So, heavy menstrual bleeding. Heavy menstrual bleeding refers to the excessive menstrual blood loss. Okay, so there is excessive menstrual blood loss that is going to interfere with the woman's daily routine. It can affect her physical, emotional, social and material quality of her life. Okay, so that is heavy menstrual bleeding. So, this heavy menstrual bleeding can occur alone, okay, can occur alone, or it can occur in association with other symptoms as well, association with other symptoms. So, there are adverse outcomes when the heavy menstrual bleeding is more than 80 ml volume and if it is happening more than a duration of 7 to 8 days. Clear? So, this is about heavy menstrual bleeding. The next terminology you have to know is postmenopausal bleeding. Postmenopausal bleeding. Okay. So, normally the normally the menopausal age for Indian women is 47 years and in Western world the age cutoff is kept at 51 years. Okay. So, after a period of menopause, any time the woman experiences genital tract bleeding, at least 1 year after her menopause, okay, after 1 year of menopause, then that is said to be postmenopausal bleeding. Clear? Right. Also, we have something called as postcoital bleeding, which is the non-menstrual bleeding that is happening from the genital tract itself, either immediately or shortly after the intercourse. Okay, immediately or shortly after the intercourse. Clear? Also, we have one more terminology, that is AUB, can be otherwise defined as acute AUB, where there is excessive AUB bleeding that is requiring immediate intervention. Okay, that is requiring immediate intervention to prevent further loss. Okay. So, this is also present as a chronic condition, that is chronic AUB, when the condition persists for a period of 6 months. Okay. But in most cases, chronic AUB is unlikely to have acute intervention methods. Okay. Yeah. Now, let's see how the assessment of blood loss is done in a case of AUB. So, that is assessment of blood loss. See, actually it is very difficult to quantitate the blood loss that is happening. Okay. So, the different methods suggested include measurement of hemoglobin from sanitary samples or sanitary napkins. Okay. So, here we will be adding sodium chloride and this will be converting it into hematine and that will be measured spectrophotometrically. Okay. However, this is not always possible in a clinical setup. So, we have another measurement of direct measurement of hemoglobin and hematocrit itself. Whenever the hemoglobin is going to be less than 12 milligram per milliliter, then you have to understand that the woman would have had a heavy bleeding, that is otherwise known as menorrhagia. Clear? And sometimes normal values of hemoglobin can also be present, but that doesn't always mean the woman didn't have a menorrhagia. Okay, so the vice versa is not. You have to understand that point. And the next one is, you can ask about the menstrual calendar to the woman. So, this means she has to maintain a menstrual calendar and put certain symbols against each day. Okay, for example, she can put X when she had a normal flow. She can put H, okay, for heavy flow, S for spotting, L for light flow, like that. Clear? So, this is how she can maintain a menstrual calendar. Okay, and sometimes we can also use PBAC. Okay, so that is pictorial blood loss assessment chart. Okay, pictorial blood loss assessment chart. Okay, so this is one of the simple and inexpensive tool that is used for monitoring of the blood loss, and then it comprises of visual scoring system that depicts a good graded series, okay, that depicts a graded series of solid tampons. A PBAC score 150 is obtained means there is more than 80 ml of blood loss that has happened in the women. Clear? Right. Now, here we will be using 3 numericals to represent the amount of bleeding the woman had. For example, we will use 1 if the woman had a light bleeding. We will use 5 when she says there was a moderate staining of her tampon or sanitary pad. Then 20 means if it is completely stained. Clear? Right. Now, let's see this. So, this is a pictorial blood assessment chart scoring for uterine bleeding. 1 means it is slightly stained, 5 means it is moderately stained, and 20 means it is completely stained. Okay. So, you will mention the name of the patient and the PBAC scoring, and the days will be also mentioned from 1 to 7. Okay, and each day she has to mention how much bleeding she has and what is the score obtained, and finally the score will be calculated for how many days the woman bleeded. Okay, suppose if she is not able to follow her sanitary, she is not able to follow with the sanitary pads or tampons, we can also advise to follow in this method where she will be given 1 point if she finds each small clot, and she will be given 5 points for each large clot and 5 points for each episode of flooding she has. Okay, so that is how PBAC is used. Clear? So these are the various methods of assessment of menstrual bleeding in a woman, And next one, I want you to know about how to go with history taking in these kind of women, because this is an important clinical case also for you. Okay. So, how we will proceed with history taking and examination in this woman. So, we have to start with the menstrual history, where we will be asking her age at menarche, her last menstrual period. Then you have to ask about her frequency, regularity, duration, and the flow of her menses. Also, don't forget to ask about her intermenstrual and postcoital bleeding history. And then you have to ask about her sexual and reproductive history as well. Clear? So, apart from this, you will be getting her obstetric history, including how many number of pregnancies she had, what is the mode of the delivery, like that. You have to ask about her fertility desire. Okay, either she is willing for carrying children or there is a history of subfertility. Then any history of current contraception methods she is using. And finally, you have to ask her about her pap smear history as well. Clear? Right. Now, let us discuss what are the associated symptoms you have to question her other than this bleeding history. Okay, so this can be even systemic symptoms. Okay, so the symptoms can include the other history you have to ask. Okay, that can include weight loss, pain, any discharges present. You have to ask her about her bowel or bladder symptoms. Then signs and symptoms of anemia, signs and symptoms, or if there is a history of bleeding disorder. She is on any medications, so what is her current medication history? And finally, you have to even ask about her family history, that will be including coagulopathies, malignancies, and endocrine disorders. And then we have to look on the social history, whether she is using tobacco, alcohol, or history of any drug abuse. Don't forget to ask about her occupation, because the type of occupation will have an impact on the quality of life. Okay. And finally, we have to ask about her surgical history as well. Clear? Now, let's discuss about the physical examination. Okay. So, physical examination. Physical examination should include vital signs, definitely, that will include your blood pressure as well as BMI. Then your signs of pallor, you have to look for the skin or the mucosal pallor, and definitely you have to look for the signs of endocrine disorder as well. So you have to examine the thyroid, okay, for enlargement or tenderness. Then you have to look for excessive or abnormal hair growth patterns. Look for clitomegaly, acne, and signs of hyperestrogenism like hirsutism and all. Okay. Okay. And another specific examination signs we have to note is the signs of coagulopathies. Okay. Coagulopathies that will include examination of bleeding during brushing or petechiae. Okay. And don't ever forget to do an abdominal examination. So while doing abdominal examination, you will be able to look for any pelvic or abdominal masses. Okay. And finally, we will be doing a pelvic examination as well separately. Okay. So pelvic examination should include a per speculum and bimanual examination. So that should include pap smear if indicated now, and then also an endometrial biopsy. Clear? I know this is vast, but you have to keep it in mind. Okay, so this is very important case. And to summarize, how I can explain you in short means, first you have to ask about the menstrual history and the intermenstrual, postcoital, sexual and reproductive history. Okay, it's not the first. The important history that you have to obtain for abnormal uterine bleeding. Okay, that is what I am speaking about. Then you will be obtaining an obstetric history, fertility, contraception, pap smear history. And then you can come to ask about the other histories, other symptoms what she has, okay, other systemic symptoms and other associated symptoms she can have. Okay, followed by that, it will be going for her other family history, social history and occupational history. And then you can go to do a physical examination where you will be doing a general examination of her vital signs of pallor, signs of endocrine diseases. You have to examine the thyroid, hair growth, and look for the signs of fertilization, like whether there is hirsutism, clitomegaly or acne. And finally, never forget to examine for her signs of coagulopathies. Okay, when you mention about this, you will be getting more marks. Okay, but at the same time, you should explain why you are doing this examination. Suppose you say there is no signs of petechiae, then the examiner will be asking you, why did you look for petechiae in this patient? What do you expect? Means you have to say, ma'am, there can be coagulation disorders. Okay, so that should be mentioned. Then abdominal examination and finally pelvic examination. Anyhow, this pelvic examination is not needed for undergraduates. Okay, but anyhow, you have to mention, yes, per speculum examination has to be done in this woman. Understood? Yes, right. Now, let me talk about the causes of reproductive tract bleeding now. Okay. So, what are the various causes of reproductive tract bleeding? First one is pregnancy related bleeding. Okay. So, pregnancy related bleeding is constituting about 15 to 20% of the abnormal uterine bleeding causes, and there can be structural or non-structural causes as well, and other causes that can lead to bleeding from the lower genital tract and bleeding due to any systemic disorder. Okay, bleeding due to any systemic disorder. Okay, you have to keep that in mind. Okay, now you can ask me, ma'am, how did you bring pregnancy related bleeding here and tell AUB? So, yeah, pregnancy related bleeding can also lead to excessive blood loss, right? So, let us discuss what are the abnormally happening bleeding during pregnancy. Okay. So, some of the causes include implantation bleeding. Yes, implantation bleeding is considered to be a normal phenomena, but even then it is not going to happen in all women. Okay. So, there can be implantation bleeding, or it can also happen in case of abortion or miscarriage, a bleeding that is happening in a case of hereditary-form mole, or an ectopic pregnancy, and finally, when it happens due to any post-abortal or postpartum causes. Clear? Right. Now, we have a special classification for defining the structural and non-structural causes. Okay, so this is done. We are looking for the structural and non-structural causes now. So, to find this, we have a special classification called COEIN classification. Okay, so it is COEIN classification. Very, very important. Okay, so let us see the classification. So, this is it is. Okay, so POM means it is including polyp, adenomyosis, leiomyoma, malignancy and hyperplasia. Okay, the leiomyoma can be a submucous leiomyoma or any other type of leiomyoma. Then COEIN means this includes coagulopathy, ovulatory dysfunction, endometrial, iatrogenic and not otherwise classified. Basically, POM includes all the structural causes of AUB, and COEIN, okay, includes all the non-structural causes of AUB. Clear? And I want you to know about the leioma subclassification system also. Okay, so leioma subclassification systems classifies the leiomyoma based on the location. Okay, and it is given a distinct number. Okay, for example, 0 means it is pedunculated intracavitary leiomyoma. 1 is given for a submucous leiomyoma which is less than 50% intramural. Then 2 is given for a submucous leiomyoma which is more than 50% intramural. 3 is given for a leiomyoma which contacts the endometrium, but it is also 100% intramural. Okay. Then 4th one is an intramural leiomyoma, but it is not contacting the endometrium. 5 number is given for a subserous leiomyoma which is more than 50% intramural, and then subserous leiomyoma which is less than 50% intramural. 7th number is given for a subserous pedunculated leiomyoma, and the other types of leiomyoma is given 8th number. Okay, so that includes your cervical leiomyoma or a parasitic leiomyoma, etc. Okay, so if you see this picture, you will understanding. Okay, so it all starts with the pedunculated intracavitary leiomyoma. Okay, then the leiomyoma becomes less than 50% intramural. Then the leiomyoma becomes more than 50% intramural. Then it becomes an intramural leiomyoma which is contacting the endometrium. Then it becomes an intramural leiomyoma itself. So, likewise, it will be moving from the inside to the outside. Okay. So, you have to know this table also well. Okay. So, this is all about your COEIN classification and the leiomyoma subclassification system. Clear? Now, let us see what is the lower genital tract causes of bleeding. Okay. So, lower genital tract causes of bleeding. So, this will include trauma. Okay. So, trauma can happen anywhere, over vulva, vagina, and due to any forgotten foreign body. Next, it can happen due to malignancy, where malignancy of vulva, vagina, fallopian tubes, and hormone producing tumor of ovary or causing bleeding. The next one is outlet obstruction of genital tract. So, these include longitudinal or transverse vaginal septum, and finally, the other causes that can lead to lower genital tract bleeding or vaginal adenosis and then granulation tissue following surgery. Clear? Right. Now, let us see what are the causes of bleeding due to systemic disorders. Bleeding due to systemic disorders. So, these include conditions like endocrine disorders that can be due to hypo or hyperthyroidism, adrenal disorders, PCOS, diabetes mellitus or obesity, and then can be due to hormonal intake, okay, like when she is on sex steroids or corticosteroids. And finally, we can have causes of coagulopathy, as well as I want you to include the causes of hepatic failure and chronic renal failure as well here. Okay. So, these are the various causes of bleeding we can have. Okay. Various causes of reproductive tract bleeding. Okay. So, we have discussed about the COEIN classification as well. Okay. So, with this we will be completing chapter 1 on abnormal uterine bleeding. Until we meet in the next video, take care, happy learning and bye bye.